We set up the Manchester Hip Clinic about a year ago because we felt that healthcare in general in the UK, there's a real lack of a comprehensive service, particularly in orthopaedic surgery. And what we've tried to do is bring together a number of experts in their own fields into one place. So it's not just about one surgeon or one physiotherapist. What we've done is we've brought in kind of very high-level surgery, but with excellent diagnostic imaging through our radiologist, with a fantastic group of physiotherapists who are used to dealing with high-level patients and high-level athletes, as well as a hospital which can provide the whole range of hip surgery, from simple treatments all the way through to high-level sporting surgery, through to complex revision hip replacements. And we've done that all in one place, and that's really the ethos behind the clinic. We are experienced in dealing with elite athletes, but this practice is more than just dealing with professional sportsmen. It's about trying to bring that ethos to the treatment of all the patients, because there's lots of patients who have daytime jobs, but for them sport is very important and they want to try and get back to that as soon as they can. So the expertise we've got from treating these elite people, we're able to bring across to the general population so that they get the benefit of that kind of care as well. We've got two main groups of patients. One are people with sporting injuries who often get a lot of groin pain or hip pain when they do exercise, particularly in their 20s and 30s. And our other group might be older patients who have some wear and tear in their hip or arthritis. And so when either of these come to us either through their GP or through their physiotherapist, they'll often have lots of questions. We do advise people to go to our website first because that often gives them a lot of background information as well as profiles of the people that they'll be meeting when they come to the clinic. Then they'll usually have been through a rehabilitation process before they get to us through their own physios. So by the time they come to see us, they'll have an idea of what's going on with their hip and maybe even what kind of treatment they'll need. When they first make contact, they'll speak to our practice manager who will explain the whole situation for them, how to book into clinic, find a date that suits them best. And then they'll make an initial appointment to see me first. We'll go through all their history in great detail, do a proper examination, and then try and work out what kind of investigations they might need, so we get a bit more information as to what's causing their problem in the first place. After they've had those investigations, which might be simple x-rays or they may need some special scans, either a CT or an MR scan, and then we'll bring them back to clinic after that and go through all that imaging so that they understand what's caused all their problems. And then together we make a decision as the best kind of treatment for them. Sometimes that might be physiotherapy, sometimes it might be injections, or sometimes it might mean going straight for surgery. But without that information, it's hard for the patient to make an informed decision as to what suits them best. They'll start rehab almost on the day of their operation, and certainly the following day they're back walking no matter what type of operation they have the following day. Hip replacement patients are usually home within 2 or 3 days. The keyhole surgery patients either go home the same day or the next day. They'll see the team of physiotherapists while they're an inpatient, and then they will hand over to the therapist in their local clinic for more complex physio, which will often be within the first week or so. Certainly our experience is that rehab is just as important as the surgery. So it's the combination of those two things which produce a good result at the end. And certainly we see patients at 6 weeks, then at 6 months, but then we keep in touch with all our patients through function questionnaires in years to come, just to make sure that they've achieved what they want to achieve and they're still maintaining a good result. Whatever their problem is, they know that they'll get the best level of service all the way through their patient journey, no matter what kind of operation they get or what kind of care they need. Right down to, from me down to my practice manager, to the support staff in the hospital, through to the nurses on the ward or the cleaners on the ward. They're all excellent and they all take great pleasure in what they do. Well, I trained originally in Dublin. I went to Trinity College in Dublin and spent my first 2 years of training there, and then quite early on moved across to Manchester, where I did all my surgical training and then finished in 2006. So since then I've worked as a consultant both in private practice but also in the NHS, really focusing on hip patients. Quite early on in my practice I realised there was a large group of particularly younger patients with hip pain which weren't being properly diagnosed or treated. And that's where the whole development of keyhole hip surgery started to come in. From 2006, my practice almost entirely became focused on hip surgery and dealing with patients with hip problems. And the majority of those are either people with arthritis who need some form of hip replacement, but also people with sporting hip injuries who develop deep groin pain after exercise. Those we treat with keyhole hip surgery, which is a very new but advancing form of surgery. And of that, we do very high numbers, probably in the top 5 of the UK. being able to take a patient who's in constant pain, unable to walk, unable to do any of the activities they used to love doing, and within a couple of days they're able to walk pain-free, back doing sport, doing exercise. It's a very rewarding thing, particularly in this day and age, where sometimes getting people access to healthcare can be difficult.